Wow, thank y'all for hopping on tonight. We got a rocking crowd to discuss one of my favorite topics, Medicare. I've been doing Medicare for 6 years now. I have deemed myself the Medicare Master. So I'm excited to share some things and some different changes that have happened through COVID-19. So we're going to talk a lot about a lot of great information. My name is Reid Mathews. I'm with Berry Financial, the Chief Operating Officer. Tonight we've got Richard Berry, the Chief Executive Officer, President, and Co-founder of Berry Financial Group. What we've done, this is week 6 of our 7-week series. That is hard to believe. We are absolutely moving along. COVID-19 started 2 months ago, really. It's continuing on today. We're looking at different strategies. Mr. Berry wants to share an update of things. We feel very blessed to have him on tonight. So with that, I'm gonna hand it over to Mr. Berry.
Thank you, Reid. I want to welcome everybody. Good afternoon. I hope you're doing well. It's hard to believe that we've been doing these webinars for about 6 weeks. And I'll be very frank with you. I have really enjoyed it. I've enjoyed spending this time with Reid. I feel like we've been able to give some incredible information to the viewers, our clients and potential clients, and there'll be no exception to that again tonight. Reid's going to really cover the mechanics of Medicare. You know, it may not be the most interesting topic, but here's what we do understand, that retirees are very concerned sometimes, and they take their health care very serious. Some of the remarks I want to make is, you know, I've seen in my 55 years, I've seen quite a few things. But one thing I've never experienced is anything like a pandemic like we've seen with this coronavirus. What we've seen over the last 6 weeks is we've absolutely seen our economy be decimated. It's come to a halt. But what we're starting to see is the clouds are starting to open up and the sun's coming out again. Our governor, McMaster, you know, recently came on this past week. And what he's doing is we're starting to open some businesses that are considered non-essential. Department stores are starting to open back, flea markets, the florists, bookstores, music shops, and I know a lot of you probably are happy about this, is the boat ramps. And some of the beaches are being opened back at this point in time. And so, you know, people have been, you know, just shut in for a long period of time. It drives people crazy. And, you know, we still want to exercise social distancing. You know, it's definitely working because now they're starting to relax some of that. In terms of Congress, we've seen a lot of stimulus money that are being poured back into businesses and also individual families. I think a lot of people are still waiting on those checks. About $2 trillion in stimulus monies have been poured out into businesses. The Senate just this past week approved for additional $500 billion, that's what it'd be, more for what we call the payroll protection plan for small business owners, and also monies to help hospitals. So the scary thing is we're spending a lot of money, and this money is eventually going to have to be paid back. So I think it's going to be even more important for you to make sure that you're in some of the right positions to take advantage of reducing taxes, but also take advantage of extreme market volatility that I think we're going to see for quite some time. You know, the unemployment numbers came out this week. They did not look very good. We've got about 22 million people who are unemployed. That number is going to continue to climb. And Reid, I'll tell you something I saw that was very interesting, I've never seen in my lifetime, is we're basically seeing a collapse in oil prices. I've been saying this for the last 6 weeks. We've had a major storm brewing between Saudi Arabia and Russia, and they kept mass producing. They were just basically creating a glutton of oil out there. And think about it, nobody can buy it. We're basically in a shelter-in-place position still across the country. The airlines aren't running their planes. And what I saw this week is that the oil was minus $37 a barrel. What that really means is that these oil companies that are producing the oil, they're having to pay somebody $37 to take the oil off their hands. I have never seen it. Now, we've seen some bounce back. I think the oil, let's see, a barrel of oil, maybe it's between $13, $15 a barrel at this point in time. I don't want anybody to think, oh my gosh, I'm going to go to the gas station, I'm going to fill my car up, and it's not going to cost me anything. Keep in mind that if you look at 50% of gasoline, only 50% of that is comprised of oil. So you're not going to see that. But what you are seeing is that this glutton of oil is absolutely hurting our energy companies, our oil and gas companies in America. And what we're trying to do is a lot of these companies are trying to furlough, shut off people. They're trying to preserve cash. And so I've never seen anything like it. This is the craziest thing I've ever seen. The market as a whole, it's been on a roller coaster ride. Hang on, everybody. This roller coaster ride is not over. The market overall, we saw back in March, we saw the market take a substantial hit. It pulled back about 30%. We've seen it come back some. And let me assure everybody, we're not in recovery with the stock market. What you've got is you've got that you've seen the market come back because people we really feel that in terms of the pandemic that we're on the downturn. We know we are. We're seeing deaths decrease. We're seeing the admission in the hospitals go down. The numbers are a lot better than once thought. The numbers have changed multiple times, by the way. Thank God for that. That's amazing. But listen, the economy is going to stay in a funk for a long period of time, and we're not going to see the real repercussions of what the recession that we're going to go into. We're not going to see that probably for 6 months or longer. You're going to have some small businesses that will not be able to recover and come back. And I have not seen an economist yet who thinks that we're not going into a recession. Just about everyone that I've read about has said it's imminent, it's going to happen, okay? And so I would use caution. At Berry Financial Group, I think the word Reid for us is to use caution when it comes to investing money. You know, and our philosophy has been preservation of assets. So please be careful. Don't try to buy on these dips and then try to get out. That's a sucker's game. And most of the people that Reid and I see, these are people that are not trying to make a ton or trying to make great returns. Their number one goal is peace of mind, and they understand if they can get a reasonable rate of return going forward, they're happy with that. And listen, that's what I've been able to provide to clients now for about 33 years. Reid, do you know who a guy by the name of Charlie Munger is?
That's Warren Buffett's good buddy.
See, I didn't tell Reid I was going to bring up Charlie Munger, but he's actually the vice president of Berkshire Hathaway, and he's a longtime friend of Warren Buffett. And I was reading about him this past week, and, you know, listen, if you're going to get some advice, let's get it from the best, right? And so he made a few statements that I thought was worth mentioning tonight at this webinar. And what he said is that he's making it very clear that this is a time for caution rather than action. And what I think he's really saying there is this is not a time to trying to be buying down on the dips. I think you need to use caution, but I also think it's a great exit strategy. If you're sitting there listening to me and you know that the unemployment is going to continue to rise and that businesses are not going to make money for a long period of time because we're still in a shelter in place, then you know common sense that the market's got to pull back again. So why would you stay in a position to take on those losses? One thing that I've done for clients for 30-some years is we show people how to position their monies that rewards the market volatility, but absolutely gives a guarantee that you can't lose. The other thing that Charlie Munger had to say too is that everybody talks as though they know what's going to happen. And here's a fact. Nobody knows, not even Charlie, not even Reid, not even Richard Berry. And so Charlie goes on to say another thing that I think is worthy to mention. He said, we're having a recession. The question is how big and how long? So I just want to thank y'all for just tuning in. Reid's going to dive into the Medicare at this point in time. Understand, I'm here to help you. I've been very blessed with a great staff. We're still working. We're doing a lot of virtual stuff. We're doing Zoom calls. We're doing all kind of conference calls, FaceTiming people. And Reid, this has been a good outlet for me because I feel like this has been a good connection, not only with clients who've been tuning in, but also with new people kind of getting a feel for who we are. So I'm going to turn over the presentation on Medicare to Reid right now. I look forward to you tuning in again next week. We're going to have a guest speaker that's going to talk a little bit with us. You're going to really enjoy him. So God bless everybody, and God bless America.
Awesome. Amen. I got my red, white, and blue on for America. So Mr. Berry has been embracing the Zoom technology, but rest assured we're not going to make him the chief technology officer. We are not making him that. I don't know where the stock market's going to go, but I tell you, I do know a lot about Medicare because I've spent the last 6 years of my life learning about it. When I graduated college, I had no idea I'd be learning about Medicare, but what a blessing it was because health insurance is arguably the most important decision you'll have to make. With the COVID-19, there's been some changes with Medicare, not huge changes by any means. So what tonight's going to be is really a little bit about some of the changes and more specifically about Medicare in general. It can be as confusing or as simple as you need to make it or want to make it. My goal tonight is to simplify it as much as I possibly can. Just like we do with all these webinars, especially, we try to do it all the time, but especially when times of COVID-19, we're praying for everybody. John 14:27, peace is what I leave with you. It is my own peace I give you. When we like to read different things about the Bible, we go straight to the truth because the Bible is the truth and Jesus Christ and the Lord have given us peace. Timothy 1:7, for God has not given us a spirit of fear, but of power and of love and of a sound mind. In Deuteronomy 31:6, be strong and courageous. Do not be afraid or terrified because of them, for the Lord your God goes with you. He will never leave you nor forsake you. What encouraging words straight from the Bible. And then, of course, we have our disclosures. This isn't soliciting anything tonight. This is just purely educational. Medicare updates from COVID-19. Here are some things that I feel like are important when it comes to COVID-19. Testing for COVID-19 is covered under Part B when it's ordered by a doctor/healthcare provider that accepts Medicare. So thank goodness for that because testing for COVID-19 is covered. Medicare beneficiaries who do get tested for COVID-19 are not required to pay that Part B deductible, which is $198 for 2020. So we'll talk a little bit more about that. Based on a provision in the CARE Acts, if a vaccine becomes available for COVID-19, Medicare is required to cover the vaccine under Part B. It's very important with no cost sharing for the Medicare beneficiaries. So if a vaccine does become available, Medicare will cover it under the medical Part B. In response to the national emergency national emergency declaration related to the coronavirus, CMS is waiving the requirement for the 3-day prior hospitalization coverage before you can get care at a skilled nursing facility. That's important to know. That 3-day window before you can get care under the Medicare A and B for the skilled nursing facility is being waived due to the national emergency declaration. So these are big things. And I'm praying nobody out there gets COVID-19. I'm praying you don't even know anybody personally that gets it, but it's good to know that Medicare understands that pandemics happen. And at the end of the day, people have health insurance, long-term care insurance to help if they get sick. So some of the biggest things people have with insurance companies is, well, my goodness, if I actually have to file a claim, it's not even going to pay. Well, that's not true. Some of the carriers that we use are some of the most reputable in the country, in the world rather, and Medicare is doing a great job through it all. They've got a ton of resources on things with Medicare.gov. I researched it. There's a ton of great links. Telehealth. I will say that again, telehealth, where the health advice over the phone is getting huge nowadays. They got some great resources with that because, you know, I've personally thought about it myself. If I get sick, do I want to go to a doctor with other sick people? I don't know. You know, this stuff is new for me. I knew it's new for everybody, but Medicare is doing a great job with resources on the web during this difficult time. Is Medicare confusing? I mean, when you think about it, you got Part A, you got Part B, Part C, Part D, HMOs, PPOs, POSs. You got Plan Gs, Plan Fs, Plan Ns, K plans. Is anybody having fun yet? Because I'm having a ball with this stuff. You got deductibles, you got copays, tier 1, tier 2s. Yes, Medicare is confusing. It's my goal tonight to simplify it as much as I possibly can, because at the end of the day, when you have to make a decision, if you feel confident, whether it's with us at Berry Financial or whether your current insurance agent and company you use, really find somebody that's confident and they can simplify it as much as possible for the decision. And that's my goal tonight. What is Medicare? It is federal health insurance program for people 65 and plus. It's also insurance for people under 65 if they've got certain disabilities. And then people with end-stage renal disease, which is permanent kidney failures, that needs dialysis, it's sometimes called ESRD. They can also get that. So Medicare covers under 65 if you're on disability, typically for 2 years, and also the end-stage renal disease. And then for people over the beautiful age of 65. So when I first started working here, I was 22. I knew nothing about anything, but the first thing that I learned was about Medicare. And I had no idea that I'd be helping people with their health insurance 65 plus, but it's been a blessing to me. So for everybody that has their Medicare with us or I've talked to about it, thank you all for that. When you sign up for Medicare, if you are already getting benefits from Social Security or the Railroad Retirement Board, you'll automatically be enrolled. So let's say you're getting Social Security and you're 63 years old. Sometimes you say, hey, you know, do I need to sign up for Medicare? No, if you're already getting Social Security, you're automatically going to get enrolled. You're going to get your red, white, and blue card, Medicare card in the mail. However, if you're under 65 and disabled, you'll automatically get enrolled in Part A and B after you've been receiving Social Security disability for 24 months or 2 years. So let's say you go on Social Security disability. After 2 years, you'll be automatically enrolled in Medicare. If you are 65 or 65 plus and you're not taking Social Security, then you will have to manually enroll by either going to Medicare.gov or calling the Social Security office, and they can walk you through that. It's a fairly simple process, but with technology and people calling, you know, all these government companies right now, it may be a little hard to get somebody on the phone. But that is signing up for Medicare A and B. If you're already getting Social Security, you'll automatically be enrolled. You'll get that red, white, and blue card 3 months before you turn 65 or the 25th month of disability benefits. You can choose to keep your Part B, and then you'll begin paying Part B premiums when you become in force on Medicare. You can choose not to keep Part B, and once you get that red, white, and blue card, you can actually return it. But if you return it, you may have to wait to enroll in a different period, and you may pay a penalty if you join later. So that's important to know. If you're not automatically enrolled, when can you sign up? You can sign up during the initial enrollment period. So initial enrollment period, IEP, that is the 7-month period beginning 3 months before you turn 65. That includes the month you turn 65, and then it ends 3 months after the month you turn 65. So if I turn 65 in May, my initial enrollment period would have started in February, March, April. So it would have started in February all the way through this month, then through June, July, August. So I got a good window for period. However, outside of that period is something called your special enrollment period. Let's say I was supposed to sign up for Part B when I first turned 65, but I was covered. I was covered on my spouse's plan. I was covered on my current employment plan. So I didn't need Part B. There's no point in paying for something you don't need. So I turned my card back in, but now I'm 67 at this time. Now I'm retiring. Well, then you go into what's called your special enrollment period. You call them up. You say, hey, I didn't sign up at 65 because I was already getting health insurance through my employer, but now I'm off of it. Can I get coverage? Can I get Part B? Yes, it's actually that period's during the 8-month period that begins the month after employment or the coverage ends, whichever happens first. Then a lot of times you'll have to have proof from your current employer that says, hey, John Smith is going off of coverage on May 31st, 2020, which means you are special enrollment period to automatically get coverage the first of the next month. Enrollment still, you have general enrollment period. So let's say you didn't sign up for Part A and B during your initial enrollment period and you don't qualify for a special enrollment period, then you can actually sign up January 1st through March 31st every year. However, your coverage won't start until July 1st of that year, and you'll probably pay a higher premium. What does that really mean? And what do I want you to get from that? 99.9% of people that I've personally met will sign up during their initial enrollment period when they're turning 65 or when they first get their Medicare card or whenever they get off their employer plan if they're over 65. So the special enrollment period and initial enrollment period are the two most used by far. However, there is what's called the general enrollment period. Then you've got the annual enrollment period. This is October 15th through December 7th every year. So that's called, a lot of people can consider it open enrollment. It is actually termed annual enrollment period. This is when you can make some changes you can go from original Medicare to a Medicare Advantage plan or vice versa. You can switch from one Medicare Advantage plan to another Medicare Advantage plan. And this is a biggie. You can switch prescription plans. So there's a few other periods we'll talk, going forward about, but the annual enrollment period every year from October 15th through December 7th is really game on. If you're looking at making some changes, make them during these time frames. And with the other thing about this is, so let's say you make the change October 15th, boom, you are a go-getter, you make the change that day. It actually doesn't go in force until January 1st of the next year. So if you made a change in October of 2019, it went in force January 1st, 2020. The Medicare Advantage open enrollment period. This goes from January 1st to March 31st. You can change from one Medicare Advantage plan to a different Advantage plan, or you can actually drop your Advantage plan and return to original Medicare A and B. Well, the problem with doing that at that time is you typically can't get your prescription drug plan because that would have had to have been done during the annual enrollment period. So this stuff is confusing, but we'll simplify it all when it's actually making decisions. There's really two things that I dive into detail with that I think is most important, and this chart is the number one. Because see, on this chart, you're going to find yourself on one of these two sides of the chart. The left side, which I'll refer to throughout this the next 20 or 30 minutes or so of this presentation, is going to be considered the left side, original Medicare. That's where probably 80% of our personal clients go with original Medicare, where you have your Part A, which is your hospital visits, your Part B, which is your doctor's visits, and that'll be on your Medicare card. It'll say John Smith, Part A effective date, May 1st, 2020. Part B effective date, May 1st, 2020. Then on original Medicare, you get your prescription drug plan, typically, and then you go down and you get yourself what's called a Medicare supplement or a Medigap policy. Because see, Medicare only covers 80% coverage. So why does somebody need a supplement, or why do we recommend it? Well, do you want to have 80% of your medical events covered, or would you rather have 100% of medical events covered? Especially when you're 65 plus, you want 100% if at all possible. So you would have 3 cards on original Medicare. You'd have your Medicare card, you'd have a separate prescription drug plan card, and then you'd have a Medicare supplement policy card. 3 cards for your coverage. Or you can go on the Advantage plan. These are your HMOs, your PPOs. We'll talk a little bit more about those. They typically combine your Part A, B, and usually your Part D. And sometimes you can add drug coverage, but typically they cover everything. So some of the questions read, why would I go with a plan on the left side that I got to have, I don't know, 3 cards when I can go to the right side where I have maybe 1? Well, we'll talk a little bit about this, but the original Medicare with the supplement, if you have a Medigap policy, if the doctor takes Medicare, he has to take your supplement. If you have the Advantage plan, he may not have to take your Advantage plan. So that's one of the pros. The Medigap and supplement policies travel well because of that. So if you're somebody who goes out and about, you travel up north, you travel out west, you travel down south, you go to all these places, most people like to know they're covered no matter what. Versus the HMOs and PPO plans, you typically have to be in network unless you got some type of emergency. Well, of course, on the left side, with the Medigap and the drug plan, you typically pay more. No doubt about it. You will typically pay more as a monthly premium versus the Advantage plan. How much? Anywhere from $100 to $250 on the left side versus some Advantage plans. I can't go into specifics due to compliance and things about different plans, but some Advantage plans are $0 premium. I mean, a literal $0 premium for your medical and your prescription. Sometimes the Advantage plans give you a dental plan. They give you a gym membership. I mean, they are amazing. That's what you see on the commercials all the time. Some of the downsides to the Advantage plans, though, are once again, you typically have to be in network. And if you start using it, you'll pay a couple $100 out of pocket. At most, you could be on the hook for $7,000 is typically the max out of pocket every year. Well, on the Advantage plan, the biggest downside is if you go to an Advantage plan and let's say your health changes, you have a stroke, heart attack, cancer, and you're like, Reid, can I go back to the Medigap plan? No, you typically have to be insurable. When you're going on to Medicare originally, your first time, you're saying, hey, Reid, my Medicare Part A and B is effective May 1st. You know, what can I do? You can do whatever you want. You don't have to answer health questions or anything. You're like the #1 pick in the NFL draft. You get to pick whatever team you want to. However, after the initial enrollment period, you will begin to have to answer health questions to become insurable. So let's say you get a Medigap plan and 3 years from now, the premium increases. Well, they're all going to increase. Let me just be the bearer of bad news on that, and I hate that, but they are. But let's say you say, Reid, hey, can I switch plans to get a cheaper plan? Hopefully, but how is your health? That's what I would ask. You got to answer some health questions, and if you've had those serious illnesses the last year or two, you typically can't change until you get better. With the Advantage plans, you can switch every year during the annual enrollment period, no matter what. With the supplement plans, you can switch at any point during the year to save money as long as you can answer the health questions. In a nutshell, the most simple explanation I've ever been given are with the Medigap supplement policies, the left side, you are budgeting for your premium. Meaning you're going to know every month, hey, I owe $100 to $300 a month, and I know that's my cost. Versus the Advantage plan, you are budgeting for a claim. Meaning, hey, holy smoke, I got one that's only $30 a month. That's cheap, but I know if I have something wrong with my health, I could be on the hook for $1,000 one day. So boom, I get sick, I got an accident, I go to the doctor, I get a bill for $1,000. You won't have that problem with the Medigap policy. So with the Medigap, you're budgeting for your premium. With the Advantage plan, you are budgeting for a claim. Here's what your Medicare card would look like. We got John Smith. You know, just probably, I guess it's been 2 years now. they changed the Medicare number from your Social Security number, which I think was a brilliant idea. They say to treat your Medicare card like a credit card. You don't want just every John Doe out there getting your information. So keep it and treat it like a credit card. How much does Part A and Part B cost? Part A is generally premium free if you paid into Medicare while you were working, or your spouse paid into it for you while you were working. If not, it was over $400 a month. Well, how much is your Part B? Totally depends. It totally depends on your income. So this is another thing that leads us to getting tax-free money in the future. If you can plan for tax-free money, you may not have to pay more for Part B. But if you've done very well and your income is married filing jointly, you're filing, if you show over $175,000, yes, that's a lot of income. Not many people do. But for those of you that show $175,000 worth of income or more, and that is based on 2 years ago, by the way, then you will have to pay more. Medicare Part B and Part D are means tested. They penalize you for making a lot of money. You have to pay more for that. So that's a big deal. So $175,000 for married filing jointly before you pay more for Part B or D. Well, when one of y'all dies, if you're filing jointly, now the other one's filing single, then it's anything over 80-something thousand. So that's a big deal. Which brings up the widow's tax we talked about in past presentations. When one of y'all dies, the person will be getting less income due to losing Social Security. However, they'll still probably pay more in taxes and still probably pay more for Part B. It's a big deal. Go back and watch the tax-free webinars to look at some solutions with that. But that is considered IRMA, the Income-Related Modified Adjustment Amount, IRMA. No, IRMA is not your super friendly aunt. It's not Aunt Irma. No, this is a bad Irma. You do not want to have to meet Irma because she's going to take your money. Let's say you enroll in Part B and D late. Let's say you didn't do it during your initial enrollment period or your annual enrollment period and you enrolled late, then you got to pay a penalty for your Part B and Part D. This does not include IRMA costs by any means. You see, it's not a huge deal, but a lot of what we get asked is, Reid, I don't take any medications, so I don't want to have to pay for a prescription plan. I don't want you have to either. However, if you don't take your prescription plan when you need to, you will get penalized if you re-enroll in a future date. So what does Medicare Part A cover? It covers inpatient care in a hospital, inpatient care in a skilled nursing facility. This is where you would previously have to have 3 days in a hospital before it covers. They're waiving that due to the COVID, or if you got COVID-19 issues, rather. This is not custodial or long-term care. So the inpatient care in a skilled nursing facility is not custodial or long-term care. It typically has benefit periods, meaning if you need care after 3 days of hospital visit, if you need care and Medicare will cover it up to typically 90 days, and then you go on a lifetime benefit of another 60-day draw. Once you pass that benefit, you better have long-term care insurance. So watch our long-term care webinar to protect against that. Medicare Part A also does hospice care and home health care when it's medically necessary. Medicare Part B covers doctor services, outpatient care, home health services, durable medical equipment, mental health services, many preventative services, different screenings and lab work. Medicare Part B covers almost everything. I mean, a lot of stuff. The Medicare and You booklet is about that thick, and it is huge, but it talks about specifics, whether it be lab works, mammograms, colonoscopies. Who's had a colonoscopy lately? I hope nobody. I know mine's going to be coming in the future if the Lord lets me live that long. I'm already thinking about it. See, That's what I hear about sometimes. 65 plus, a beautiful age, but people in their 20s don't typically talk about colonoscopies, but I do. It's a blessing too. So different things with Part B. What's not covered by Part A and Part B? That's what I want to know. Most dental care. Most dental care is not covered by Part A and Part B. So Mr. Berry mentioned right before he got off that we're going to have a guest speaker next week, and that'll be at the end, but I'll go ahead and share with you because we're talking about dental care. It'll be Dr. Jordan Berry. So that is my brother-in-law who is a dentist. He is exceptional. I'll talk more about him at the later, but A and B does not cover most dental care. It doesn't cover eye exams, dentures, cosmetic surgeries, massage therapies, acupuncture, hearing aids, and long-term care. Can you believe that? Most retirees need dental care and eye exams, and Medicare does not cover it. So we'll talk a little more about that later. Medicare Part C, these are the Advantage plans. These are the Advantage plans. They're offered by Medicare-approved private companies that must follow rules set by Medicare. You'll still have Medicare, but you'll get your Part A and Part B coverage from the Advantage plan, not from Medicare. So Medicare pays these private companies a flat fee, and then based on that flat fee is how they can design these different coverages. So what are some of the types of Advantage plans? Health maintenance organizations, HMOs, PPOs, PFFSs, SNPs, HMOPOSs, and MSAs. So we got the alphabet going on tonight. Medicare Advantage plans. They have to cover all A and B services. However, you may pay more for services from doctors who are out of network. That goes back to me mentioning the thing about being in network with Advantage plans versus supplement plans. Most have a yearly limit on your out-of-pocket for medical services. And by most, I mean all. That can almost be $7,000. Some offer supplement benefits, fitness memberships, dental plans, vision. So see, this is what I personally hear on TV. And if I didn't know bad stories about Advantage plans, I would think everybody needs them. What's not to like about this? $0 premium, gym membership, dental, vision, and then just a great overall experience. That's what these commercials say. And you know what? Some people love Advantage plans. That's why we offer them. I have talked to plenty of people who say, Reid, oh my gosh, I love Advantage plans. I typically ask them, well, tell me about how much you use it. And they typically say, I'm pretty healthy. I never really use it. Boom, you love it. You're going to save money with them. No doubt about it. But I can tell you this, I've never had somebody beg me to get them off of a Medigap supplement plan. It covers. I have had people beg me to get them off of Medicare Advantage plans. Not all Medicare Advantage plans. I sell Medicare Advantage plans. So I love Advantage plans for the right person, but you got to understand it. You need to understand it. If you have a health issue, there's a good chance you're going to pay a couple $100, if not a couple $1,000 out of pocket. If you're okay with it, you got to understand you could get denied when you go to your favorite doctor one day if they decide not to take that Advantage plan. If you understand those things and you're okay with that and you are healthy and you don't use it and you like these other benefits, it's going to be great. My other personal opinion, this is totally personal opinion, is all these plans are getting expensive. I'm talking expensive. And so I personally think Advantage plans will get more popular due to the expense of the Medigap plan. They're going to price people out of the Medigap plans, force them to go to the Advantage plans, and we'll see how it shakes out. But I like Advantage plans. There's a lot of great benefits, a lot of negatives, just like everything. So now let's talk about Medigap supplement plans. You cannot have an Advantage plan and a Medigap plan. For whatever reason someone tries to sell you an Advantage plan and a Medigap plan, they can't. Any doctor that takes Medicare has to take your Medigap plan. In 2020, here we are, the F plan and C plan will no longer be offered for new people. That's a big deal. It's a big change that we went over in October's webinar last year due to the macro changes. But Medicare will no longer offer F and C plans for new people. Those are the plans that used to cover the Part B deductible. However, people eligible for Medicare Part A prior to 2020 continue to have the options to enroll in C and F plans. If you've had the F plan for 10 years and you're still healthy, you can switch to another F plan if you can get past the health question. There's going to be some new plans offered. Let's talk a little bit about them. Something about a G plan's the home run plan. You know, we talk a lot about it. We call it Cadillac plans. You know, I guess we could call it Ferrari plans or Bugatti plans. I mean, just whatever expensive car name you like. We used to call the F plan because the F plan covered everything. Look at the far right column, the very, very far right column. Before 2020, the F plan covered everything. That's why we called it the Cadillac plan. You go to the doctor, it covers. No out-of-pockets, just a higher premium. Then they came out with the G plan, which is about the middle of the page next to the K plan, the G plan. It covers everything the F plan covers except the Part B deductible, which is $198 this year for 2020. That Part B deductible, when I first started, was $147. Then it went to like 163. Then it stayed there for like a year, but it's increased every year that I've done it. The Medicare Part B deductible has increased every year that I've done it. The Medicare Part B premium has increased every year I've done it. 6 straight years. And guess what? With the deficits that we're facing, they're going to keep increasing. It's sad. I don't like to talk about it, but they're definitely going to keep increasing or something's got to give. But the G plan going forward is the Cadillac plan, covers everything. The F plan does not, except that deductible. Let's talk about prescription drug cards. Prescription drug card plans are the closest thing to Chinese that I personally know. The prescription drug plans are the most confusing and the most nonsensical things, if you will, that I personally talk about on a day-to-day basis. I talk about a lot of stuff: money, finances, life insurance, long-term care, mutual funds, exchange-traded funds, index annuities, lifetime income, Social Security. I talk about a ton of stuff on a daily basis. By far, prescription drug cards are the most confusing thing because it's not black and white. It doesn't make sense, but I'm going to try to do my best to describe it to you. Even if you don't take prescriptions now, you should consider joining a Medicare drug plan due to the penalty. If you have an Advantage plan, you typically have a prescription plan included. If you go with the supplement plan, you typically need to pick up a standalone PDP, prescription drug plan. Your initial enrollment period and the annual enrollment period for the prescriptions are the most common time to get your drug card and then also switch that drug plan. Your actual drug plan costs will vary depending on your prescriptions. Okay, that makes sense. But then whether or not they're on the plan's formulary, which changes every year, by the way, and depending on what tier the drug is in, which changes every year, by the way. So what tier is in? Tier 1, 2, 3, 4, or 5? So think about this for a second. How many prescription medications are on the market today? I wish I would have found the number, but I don't know it, but thousands, right? And then how many drug plans are there? I'd say realistically that I've found, double digits at least. And then imagine thousands of medications, double digits of actual prescription drug cards, and then throw 5 tiers onto all of that. You see the confusing part. And then depending on what tier it is, and depending on which phase you are in the drug benefit will determine your deductible, coverage gap, or etc. Also, depending on which pharmacy you use, has a preferred cost sharing plan, or if you do mail order or not. So you will have a drug card monthly, and then you'll have different copays and deductibles on the medications. So Reid, I can kind of make black and white sense of that. Here's what I personally can. When you go to a prescription card or CVS, for instance, love CVS, Walgreens, Walmart, all of them, won't say anything bad about any of them. But when you go one day and for that same medication, it's $5, and then you go 6 months from now and that same medication is $150, and then you ask them what exactly you're paying for, they never tell you. It's not black and white. I'm telling y'all, I wish it were, because I like stuff that's black and white because it makes sense. It's easy to explain. For some reason, they made this prescription stuff way too complicated. Based on the great software that we have, and based on, it does show what tiers they are, but they change all the time. And interesting to see where everything will go with the prescription drug cards. But typically, even if your prescription drug card doesn't cover that tier, I know there's a lot of different cost sharing plans that could help out. And sometimes if you get the right person on the phone at the actual drug facility, you may be able to get some benefits that way. So prescription drug plans are helping people stay alive for the right situation. I'm a huge fan of them because of the benefits of them. But it's definitely the prescription card plans. Shop it every year. We recommend that. Shop it every year because they change. People's medications change. And you can never know where you can save money or not. The infamous donut hole for 2020. The initial coverage period is after you meet your Part B deductible, you pay a copay or coinsurance for your medications. Once you and your plan combine to spend $4,000 for drugs during the calendar year, you're enter what's called the donut hole coverage gap. What that means is you'll pay 25% of generic and brand name drugs until you reach the out-of-pocket limit of a little over $6,000, and then you reach what's called the catastrophic coverage. Catastrophic coverage, you'll be charged $360 for generic and preferred drugs with retail prices under that amount, and those greater than $72, or you'll be charged $895 for brand name drugs with retail price under $179 and 5% for those greater than $179. So it makes sense to do your homework. You know, for instance, a lot of companies, if you particularly call them and tell them you need assistance, there's some companies that'll help you out. I know these pharmacies are pretty good about that, which makes it difficult for me because I don't know if you're going to get the person on the phone that's going to help you or not. But definitely interesting stuff when it comes to prescription drug plans. So question, why in the world were you ever confused? That's pretty simple, isn't it? When you go on Medicare, you're going to go to a place where you have your supplement, or you're going to go to an Advantage plan. You are going to get a prescription card, or if you're willing to risk it and not, you'll get penalized if you don't take it. If you're going initially on Medicare, you have no other coverage. It's an easy decision. You get your Part A and Part B, and then it depends on if you want to budget for your supplement or budget for the potential of a claim with the Advantage plan. The prescription plans are confusing. So why were you ever confused? The prescription plans, but we do have great software. We're licensed with great carriers to help out with that at all. So Medicare A, B, C, and D is confusing, but once again, I'm the Medicare Master. So if y'all have any questions, definitely reach out. This is my beautiful wife and my beautiful dog on the left. And then we've got Richard, Jan, and Zoe, my beautiful in-laws. Zoe was in the office today. So Zoe was wanting to hear about Medicare. My dog said that's enough. He hears enough about it at home. We used to do a bunch of dinner seminars before, of course, the restaurants close up shop. And we're praying for them to get back and rolling just like everybody when everyone feels it's right. But we do dinner seminars so you can bring your friends, eat a great meal off us at Ruth's Chris, introduce your friends to us in a non-threatening way by any means. And then you'd get a referral credit via extra credits to our client appreciation events for potential to win iPads, Kindles, golf outings. You get to come to our summer barbecue and Christmas drop-ins. Well, we're extending those referral credits for the webinars. If you've got a friend who is interested in any of our webinars, of course, tonight with Medicare, forward this link to your friend and make sure when they register, make sure they put your name in that link so we can give you that credit. That's very important. The referrals are the nicest thing you can do for us. That's the biggest value that we are ever given. It's a huge deal, but make sure we want to give you credit. We want to give you credit, so make sure they put your name down. How do you schedule a meeting? It's amazing nowadays with the technology. So go to this link, www.barryfg.com/schedule meeting. If you want a quote, if you think you're paying too much for your Medicare, if you want to make sure you got the right plan, go to this link, www.barryfg.com/schedule meeting, www.barryfg.com/schedule meeting. Just go to our website. If you go meet with us, it's a great way. It'll forward you a link. You get to do a lot of it online without ever talking to somebody on the phone. It's amazing now, but we will get back to you with the great service you've come to learn to expect from Barry Financial. Join us next Thursday, April 30th. Wow, the end of the month in week 7 of our webinar series. We're going to package all these webinars, and it's going to be a 7-week Barry Financial Masterclass. And we're going to discuss how we learn from COVID-19 to safeguard our health and our wealth. The guest speaker that we have is Dr. Jordan Berry, my brother-in-law. He lives probably 100 yards away from my house. He's got a beautiful little baby girl named Caroline. She's 16 months now, I guess. She's amazing, but I'm excited for him to come. This gentleman is exceptional. He's going to talk about the COVID-19 effect on dentistry, timeline for resuming normal dental care, added safety measures during and post-pandemic. This guy is in the field, the medical field. He's not only going to talk about dental stuff, although that's obviously what he does. He'll talk about the medical field in general and how we can safeguard our health, specifically in some of the things, and how to navigate the coming weeks and months from a patient's perspective. That's important to know. And then, of course, Myrtle Beach Dental Associates is his firm. That's who I go with. It's almost been a year now, but I got to share this story, and I'm sure I'll share it next week as well. But I busted my 2 front teeth when I was in 2nd grade playing baseball. So they put them back in my mouth and stuff, and I had a root canal. Well, that was 2nd grade. Well, last year, I was 26 years old in May on Memorial Day. I started feeling miserable. I mean, I had some pain back in my mouth, and I'm like, well, holy smoke, my brother-in-law's a dentist, and he lives right next door. I'm going to call him and see what's going on. It was in the back of my mouth. Well, he looks at it. He thinks he knows what it is. He said it may be my jaw. Well, he starts doing his thing on it. Doesn't get better. Next day or two, still something's going on. Like, I know something's going on, and he's looking at it. He comes in my living room one day to numb me up. He literally was numbing me up in my living room. That's the benefits of having your brother-in-law be a dentist. Well, another day or two passes. It ended up being an abscess tooth from my root canal from like 20 years ago. And he goes in there, fixes it up, does a little bone graft. I've maintained the tooth. The bone graft has worked exceptionally. So I am a huge advocate of Dr. Jordan Berry. So next week at 6 p.m., we're going to have him live, which is very exciting. And listen, Barry Financial has been giving retirees and pre-retirees peace of mind through safety since 1987, peace of mind with their money, peace of mind with their finances, peace of mind with their health insurance, their long-term care, estate planning needs, tax preparations, listen, everything. And a little tidbit about, we got a webinar at the end of May, May 28th. We've come to you with these webinars via Zoom. We're bringing a new digital experience. that we are excited. We've had some time to think about this and really try and enhance what we got going on, that we are excited to bring to you at the end of May. So join us next week for our 7-week series. It's been extremely fast. I want to thank everybody for coming on tonight. I love all y'all. If we can help you do anything, please let us know. God bless and stay safe out there.